My name's Danny. I'm here with Paul and Robin, and we're just going to be assessing the 12 cranial nerves today, okay? We're going to start with the olfactory nerve. For this one, you can just have them identify a familiar smell like coffee or something else. Have the patient close his eyes and close your left nostril for me. And then just have him smell that. Close your other nostril. Have him smell that. Can you tell me what it is?
Alcohol.
It is an alcohol. Did you notice that? You can open your eyes. Did you notice any difference between the two sides? Okay, you're just looking for a symmetry. So that's cranial nerve 1, the olfactory nerve. Cranial nerve 2 is your optic nerve, and there are several different ways that you can assess the optic nerve. You can check for visual acuity. You can check for color vision using a HRR, or you can do a direct ophthalmoscopy. But today I'm just going to do a confrontation visual field, so I'm just going to have the patient close his left eye. And while looking at my open eye, can you tell me how many fingers?
2, 1, 5, 1.
Perfect. Cover your other eye. While looking at my open finger, while looking at my open eye, how many fingers do you see?
5,
Perfect.
2, 1, 1.
Perfect. So there's no constrictions in his visual field. That's normal. And another thing that you can do is check for his pupils. So I'm just going to assess his pupils in a well-lit environment. They look equal round. When you turn off the lights, they're still equal and round, and they dilate normally. And I'm just going to check for a normal direct reaction to light on the right eye. Looks like he has a normal direct reaction to light on the left eye. You can also tell that he has a normal consensual reaction in each eye. And the last test is the APD test, and he doesn't have any afferent pupillary defects. So his optic nerve seems to be intact, normal. For cranial nerves 3, 4, and 6, I'm going to be doing a motility test. So I'm just going to ask the patient to look at my finger and follow it only using his eyes. So here you're checking for any constrictions. Make sure that both eyes follow your finger all the way in each gaze. Do you feel any pain when I'm doing this?
No.
Do you see any? Do you see 2 fingers or only 1?
Just 1.
Perfect. So he has full motility and no restrictions. So that was your ocular motor nerves that you were testing there. For cranial nerve 5, your trigeminal nerve, we're going to test the sensory portion. So just close your eyes and tell me when you feel me touch your face. Okay.
Yeah.
Okay.
Yeah. 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 Yeah.
Okay, so you're just touching his forehead, cheeks, and his jaw area. Make sure that there's no asymmetry or anything like that. You can also test the corneal sensation for the ophthalmic branch of the trigeminal nerve. So just have him open up, and he blinks, so that's a normal reaction. There you go. So just make sure that there's no gross asymmetry between the 2 sides of the cornea. And then for the motor branch, you can have, I'm going to have the patient clench his teeth and just feel the masseter muscle to make sure that there's equal, and also the temporal muscles, make sure that there's equal contraction between the 2 muscles. So that's cranial nerve 5, the trigeminal nerve. Cranial nerve 7, the facial nerve. I'm just going to assess the patient's face and make sure that there's no asymmetries, no drooping or anything like that. And have him smile. Alright, good. Frown. And then just lift your eyebrows up. Alright, and you're just looking for any asymmetries on any of the muscles around the face. And that's your cranial nerve 7, your facial muscle. Cranial nerve 8, the acoustic nerve, and the the vestibulo-ocular nerve, I'm just going to do the acoustic side of this nerve. So I'm just going to ask you to close your eyes and tell me when you hear my fingers rubbing on each other, okay?
Yeah.
Okay. Tell me when you hear my fingers rubbing on each other.
Yeah.
Okay. So you're just making sure there's no gross asymmetry between the two sides. If you suspect that there's lateralization, you can pull out your tuning fork and do a Weber and Rhine test. For cranial nerves 9 and 10, they're very closely related, so I'm just going to test them both at the same time. I'm just going to ask the patient if he has any trouble swallowing. Can you swallow for me? Did you have any trouble doing that? Can you cough? Good. All right. And I'm just going to have the patient open wide and just assess the uvula and make sure that the uvula is not deviated from the midline one way or the other. And in his case, the uvula is just fine. You can also check for the gag reflex, but I'm not going to be doing that today. The cranial nerve 11, the spinal accessory nerve. I'm just going to check his trapezius. So I'm just going to ask you to shrug your shoulders, push down, make sure that there's equal force in the contraction. And I'm going to check his sternocleidomastoid. So I'm just going to ask you to push your head against my face. Push your face against my head. Watch the contraction of the sternocleidomastoid and make sure that there's equal force between the two sides. Push your face. So there's the muscle contracting and there's equal force. That's cranial nerve 11. And then cranial nerve 12, the hypoglossal. This one you can just have the patient stick his tongue out. Make sure there's no deviation from the midline. Just have him move it to the right or to the left. Make sure that there's nothing that looks asymmetrical to you. And you can also have him say a tongue twister or something of the sort. So, what's your favorite tongue twister?
Peter Piper picked up, peck up pickled peppers.
Perfect. So, that's the basic assessment of the 12 cranial nerves.